We'll now finish up part 1, sleep disturbances, with these 5 miscellaneous ones. Mark Twain called snoring sleep out loud. Snoring occurs when there is less room for the air to travel through the upper airways during sleep. Thus, the air has to move faster, causing the soft tissue of the upper throat to vibrate. Causes are basically anything that constricts the upper airway passages or results in more flaccid tissue in the throat, including relaxation of the throat muscles, excessive tissue, inflammation, inherited differences in shape of upper airways, and diminished elasticity of the tissues that comes with age. Allergies, infections, respiratory irritants, and smoking can cause swelling of these tissues. Alcohol and some drugs can cause muscle relaxation. Lying on the back can cause the tongue and other throat tissue to be pulled back by gravity. Large tonsils and adenoids may constrict the size of the throat. Nasal congestion may force more mouth breathing. Even depression, stress, or anxiety can cause changes in blood flow to the nose, causing swelling. Snoring has long been recognized as being a problem for sleeping partners and others nearby. However, more recently, snoring has been linked to a number of behavioral problems, such as tiredness, trouble concentrating, subtle cognitive and performance deficiencies, and heart and vascular medicinal problems. There are degrees of difference in snoring, ranging from occasional mild snoring to what has been called heroic snoring. I just love that. Heroic snoring, snoring which is virtually every night and can be heard by others in distant rooms or even sometimes by neighbors. Loud and frequent snoring can be a sign of sleep apnea, a disorder we will cover in part 2 of this lecture, but not all who snore have sleep apnea. Treatments range from lifestyle changes like weight loss, smoking cessation, and not sleeping on your back, to oral appliances like mouthpieces that keep the tongue forward or advance the lower jaw, to CPAP. That's capital CPAP, which stands for Continuous Positive Airway Pressure Therapy, most commonly involving a mask, and in more extreme cases, to surgery of the throat or nose. Beware, there are many products marketed for snoring which at best are ineffective, such as throat sprays, and at worst dangerous, such as devices that hold the mouth closed. 10 to 20% of people may grind or click their teeth frequently during sleep, especially N2 sleep. But it is most prevalent in adolescence. For the majority of people, sleep bruxism is not serious, but it can cause damage to the teeth or cause sore jaw muscles for some. And in some more extreme cases, it may lead to TMD, temporomandibular disorder, often incorrectly called TMJ. While bruxism has not been shown to be associated with any psychological problems, it is often believed to be more prevalent in times of stress. Dentists can treat sleep bruxism by fitting the sleeper with a guard worn over the teeth during sleep. Enuresis, more commonly known as bedwetting, can occur during non-REM or REM sleep, usually earlier in the night. 30% of 4-year-olds wet the bed, more so in males than females, but the percent decreases with age after that. Still, up to 2% of 18-year-olds have occasional occurrences, as do 0.5% of adults. It is best not to make a big deal of continuous consecutive night bedwetting in children because, one, it is benign other than possible irritation of the caretaker and embarrassment of the child, and it is not associated with behavioral or psychological problems. And two, for some children, complete neurological control of the bladder sphincter does not develop until 12 to 15 years of age. On the other hand, the reemergence of bedwetting after months or years can indicate urinary tract problems, psychological problems, or even neurological problems such as epileptic seizures, and should be brought to the attention of a medical doctor. Some young children experience repeated involuntary muscle movements, such as rhythmic body rocking or head banging while falling asleep, or in any stage of sleep. It is not considered serious, although you certainly want to protect them from harm. For instance, you might need to pad their headboard until they outgrow this. Soliloquy, otherwise known as sleep talking, is most common in children, but also occurs in adults. Most people report sleep talking at least one time in their life. Most often it consists of a few mumbles to occasionally a few understandable words to most rarely 100 or so intelligible words. Although you might have heard accounts of two-way conversations with a somniloquist, none has been verified in the sleep lab. There is also, contrary to popular belief, no evidence of somniloquists telling secrets in numerous sleep lab studies. Today, this only appears to be a frequent occurrence in literature, such as Othello's Cassio supposedly relaying secrets in his sleep. Oh, yes, and in cartoons, such as the one on this slide. Now, this was not a complete list of all sleep disturbances by any means. There are many, many more that are far more rare, and a few of which I will mention just because of their notable names, then let you look them up if you are in fact interested. Painful sleep erections, sleep groaning, and sleeping beauty syndrome. But these are the most common and a pretty comprehensive selection for the scope of this class. This concludes part 1 of our dysfunctions lecture, exploring sleep disturbances. In our next segment, we will begin part 2, exploring sleep disorders.